Today what I'm going to do is I'm going to tell you the story of how this movie came to be. Laurie is from Canada, I'm from the United States. We, both of our children were born in Canada, in Canadian hospitals, and we lived in Canada for 10 years after our children were born. We moved to the United States then in 1992. 1992, you may remember, was when Hillary Clinton was trying to pass a health care law. At that time, many things were being said in the media about the Canadian healthcare system, which really, from our point of view, was not true. What they were saying didn't measure with our experience, and it just wasn't something that we could accept. This was one of the first things that kind of spurred me to want to do this movie. The second thing is a very personal experience that I'd like to tell you a story about. It had to do with our son. He was about nine years old at the time. I was at home with him. Laurie was at work, and he came in one day. He'd been rollerblading, and he had fallen down, and there was this big gash on his elbow. And so he showed it to me, and I kind of helped him patch it up. And then I kind of went on and did what I needed to do. I think I was probably doing computer work. Laurie was at work, and every now and then I would kind of check in on him, and he seemed to be doing okay. Laurie came home, and we told her what had happened, and she looked at this gash on our son's elbow, and this was like an hour and a half later, and it was still bleeding. And she became quite alarmed. And, the first thing that came into my mind was, we take him to the hospital, the emergency room. I don't know whether we can pay for this. That's the first thing that came into my mind. I'm not happy to say that this was my son who was in pain. And the first thing that I thought of was, can we afford to get him taken care of? That was not a happy moment for me. He needed several stitches, and that's, the moral of that story is that, I stand before you thinking, really ashamed of the fact that I had to even consider whether we could afford to get health care for my son. Shortly after this, Laurie actually went to school to learn how to do filmmaking. This was now about the time that Obama was putting forth the new bill for health care. And again, all these stories about Canadian health care started being reported in the media. It was around Thanksgiving 2009. We were sitting around with some friends, and we were actually talking about health care. And I turned to Laurie and I said, someone should make a film about the Canadian healthcare system for American audiences to kind of let people know what the true story was. So our friend there sitting there said, well, why don't we do that? So we did. This was not an easy decision for me. This was a big deal for me because, and it's explained kind of in our logo here. This is our logo, and you may be wondering what that's all about. What are these snakes about? What's that mean? Well, I want to tell you, for me, most of my life, I've been kind of this blue snake, having a lot of ideas and opinions, but not really voicing them very much. This is one of the reasons one of the purposes of this movie is to give people a voice to speak their commitment from their heart about healthcare. And so this is what happened to me. When we decided to do this movie, I found my voice. And it's designed to help every one of you and every one that you show this movie to find your voice. How many of you know who Tommy Douglas is? Anybody? Yes. Remarkable human being. Remarkable human being. He taught me several things. Now, he's not alive. He is considered the father of the Canadian healthcare system. But one of the things that my research about Tommy Douglas taught me was to ask the right questions. To ask the right questions. Now, Tommy Douglas was a man that when he saw a problem, he didn't ask whether you could solve this problem. He said, how can we solve this problem? If people need new roads in northern Saskatchewan, it wasn't whether they need them or not, it was how are we going to provide roads to those people? If they need electricity, how are we going to provide electricity to those people? If they need health care, how are we going to do that? The right question in regard to our health care problem is not whether we can afford it. The right question is, how are we going to do that? That's the question. Tommy Douglas has become one of my heroes, and every movement needs to have heroes. I think heroes are people that take stands, that kind of go out on a limb on their own without any assurance of success, just because they know it's the right thing to do. I think all of us have what it takes to be heroes. We just need to get in touch with what is in our heart, and we need to have solid, consistent, persistent actions, concrete actions that we take. And you know what? I wish I could know every single person at this conference, because I think every person here could be my hero. So, what needs to happen? These are ways that you can help us with the healthcare movement. The healthcare movement, I believe, can be a cornerstone to really educate the public in this movement. Not because of just the movie itself, but because we can bring people together to watch a movie. Our goal is to have this film seen in every congressional district in the United States. And we cannot do that without people, you people, taking on this project.